Hello everyone and welcome. Today we'll be diving deep into a potentially painful and disruptive condition, bladder ulceration. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage and, hopefully, prevent it. Understanding bladder ulceration is crucial for those who experience its symptoms, and this video aims to provide a comprehensive overview. So, what causes bladder ulceration? The etiology or the origins are multifaceted. Chronic inflammation of the bladder lining, often due to conditions like interstitial cystitis or chronic bacterial infections, is a primary culprit. Trauma to the bladder, perhaps from catheterization or surgery, can also damage the delicate lining. Certain medications, particularly chemotherapeutic agents, can be toxic to the bladder and lead to ulcer formation. Autoimmune diseases, where the body attacks its own tissues, can sometimes target the bladder, and in some cases, the exact cause remains unknown, termed idiopathic bladder ulceration. Let's delve into the pathophysiology. What actually happens within the bladder when an ulcer forms? The chronic inflammation or injury to the bladder wall leads to erosion of the protective mucosal lining. This erosion exposes the underlying tissues, which are more sensitive and vulnerable. As these deeper tissues are irritated by urine containing waste products and sometimes bacteria, further inflammation and breakdown occur, deepening the ulcer. The bladder muscles may spasm in response to this irritation, contributing to pain and urinary urgency. Over time, the ulcer can develop scar tissue, which can reduce the bladder's capacity and flexibility. While precise epidemiological data on bladder ulceration is limited, particularly due to the difficulty in distinguishing it from related conditions like interstitial cystitis, we do know certain populations are more at risk. Women are disproportionately affected compared to men. Individuals with pre-existing bladder conditions, autoimmune disorders, or a history of pelvic surgeries are also at higher risk. The overall prevalence is likely underestimated due to variations in diagnostic criteria and the fact that some cases may be asymptomatic or misdiagnosed. The signs and symptoms of bladder ulceration can significantly impact quality of life. The most common symptom is pain, which can range from mild discomfort to severe, debilitating pain in the lower abdomen, pelvic area, or urethra. This pain may worsen with bladder filling and improve after urination. Increased urinary frequency and urgency are also hallmark symptoms. Some individuals experience dysuria or painful urination. In more severe cases, hematuria or blood in the urine may be present. The symptoms can fluctuate in intensity, with periods of remission followed by flare-ups. Diagnosing bladder ulceration involves a combination of clinical evaluation and diagnostic tests. A thorough medical history and physical exam are essential, or analysis is performed to check for infection, blood, or other abnormalities. Cystoscopy, a procedure where a small camera is inserted into the bladder, allows the doctor to visualize the bladder lining directly and identify any ulcers or lesions. Biopsies may be taken during cystoscopy to rule out other conditions, such as bladder cancer, and to assess the depth and nature of the ulceration. Urine cytology, which examines cells shed from the bladder lining, may also be performed. While there aren't strictly defined types of bladder ulceration in the way one might categorize other diseases, it is helpful to classify them based on their severity and location. Some ulcers may be small and superficial, while others are large and deep, penetrating into the bladder muscle. They can also be categorized as primary, meaning they arose spontaneously, or secondary, meaning they are caused by another underlying condition like infection or medication. Ulcers can also be considered solitary, a single, or multiple in many ulcers present at the same time. Treatment and management of bladder ulceration aim to relieve symptoms, promote healing, and prevent recurrence. This often involves a multifaceted approach. Medications such as pain relievers, including NSAIDs and opioids, can help manage pain. Anticholinergics can reduce bladder spasms and urinary frequency. Bladder instillations, where medications are directly instilled into the bladder, can provide localized relief and promote healing. Surgery, such as transurethral resection or bladder augmentation, may be necessary in severe cases that don't respond to other treatments. Lifestyle modifications, such as dietary changes to avoid bladder irritants and bladder training techniques, can also be beneficial. Preventing bladder ulceration often involves managing underlying conditions and avoiding known risk factors. Treating chronic bladder infections promptly can help prevent inflammation and ulcer formation. Avoiding bladder irritants such as caffeine, alcohol, and acidic foods may reduce symptom severity. Practicing good hygiene and emptying the bladder regularly can help prevent urinary tract infections. Individuals undergoing procedures that may traumatize the bladder should discuss strategies to minimize the risk of injury with their healthcare provider. Regular follow-up appointments are important for those with a history of bladder problems. The prognosis for bladder ulceration varies depending on the severity of the condition, the underlying cause, and the individual's response to treatment. While complete cure is not always possible, many individuals can achieve significant symptom relief and improved quality of life with appropriate management. Recent research has focused on developing more targeted therapies, such as stem cell therapy and gene therapy, to promote bladder regeneration and healing. Studies are also exploring the role of the microbiome in bladder health and disease, which could lead to new strategies for prevention and treatment in the future. Ongoing research offers hope for even more effective treatments and improved outcomes for those living with bladder ulceration.